Hey everybody, my name is Wendy Lokanc-Diluzio. I'd like to welcome you to Nursing 5120, Nursing as Art and Science. This is my second semester teaching this course. I know this course at times will feel overwhelming. There are some intense readings for me as well. There's a lot of big words and some of those readings take time. Because those words are difficult to understand or because they're thought-provoking. And sometimes I find it just helpful to step away from the article and just digest what it's saying and then come back to it. I've incorporated feedback from last semester as well as from talking to students that have taken this course a few years back. So hopefully this course will be enjoyable for you. In this presentation, I'll be discussing the course objectives and assignments. I'll also try to give you some tips for your assignments. So what's ahead? In this presentation, I will tell you a little bit about myself. I will provide an introduction to the course. So I will let you know what the course description is, what the learning objectives are, as well I will get into some of the evaluative activities for this course. And finally, I will provide a bit of a discussion on evidence-based practice. So a little bit about myself. I completed my Bachelor's of Nursing degree in 1997 at the University of Calgary. In 2005, I completed my MN, and in 2014, I completed my PhD, also at the University of Calgary. I worked for Alberta Health Services Sexual and Reproductive Health for around 20 years. I was hired as an assistant professor at the University of Lethbridge, focusing primarily in nursing a couple of years ago now. And prior to that, I was working as a sessional for University of Lethbridge for probably 4 years. So even though my assistant professorship is fairly new, I've been teaching with the University of Lethbridge for quite a while. I live in Calgary, so I am based out of the U of L Calgary campus, but the majority of my teaching is online and asynchronous. When at the end of my Alberta Health Services career, I assisted with the COVID response for several months. And I'm still affiliated with the University of Calgary Faculty of Nursing as I do some co-investigation, co-PI work with my former doctoral supervisor. My research interests strongly pertain to the area of sexual health, health promotion, public health. But all of that has typically a sexual health spin on it. So for those of you that plan to go on and do a PhD, something you might want to think about is your program of research and developing a program of research or kind of having a niche area for yourself, something that you focus on so that one study builds upon the next study, which builds upon the next study. So for example, my PhD related to training service providers of street-involved youth about sexual health. And then out of that study, a recommendation came to train parents and supervisors of youth with intellectual disabilities, because oftentimes the street-involved youth also had some kind of a disability as well. So then that was my second study. Out of that second study, a recommendation was to train the youth with intellectual disabilities themselves. So my third study then was creating a program for youth with intellectual disabilities related to sexual health. So you can see all of these studies build upon each other as well. They're all related to health promotion, public health. So that's something for you to think about, that if you want to go on and do a PhD, is figure out what is your area that you love, and what is that area that you want to focus on in terms of your research. Many of my grad students right now, I think I probably have 5 or 6 that I'm supervising for masters and then 1 PhD. Many of them are actually focusing their research on immigrant health. So that's something as well that I've come to learn more about as well. A little bit more about myself. I am fluent in Friends, The Office, and Seinfeld quotes. Sometimes I make pop cultural references. I like to read pop culture and cooking blogs, and sometimes I sit with my children and we just watch TikTok videos so I can be up to date with, what the young people are into these days. And what else can I say? I love my coffee. I can't function without it. I hate taking selfies. When we have family functions, I'm the one taking the pictures and I'm not the one in the pictures. I'm not on social media, have never had a Facebook account, at least not personal accounts. I've had them for work or some of my research projects, but not personal accounts. Now on to discussing the course. In the course outline, the course description states, in this course, students will explore the foundations of the nursing profession by discussing the work and contributions of nursing philosophers, theorists, and scientists. Nursing knowledge will be discussed as a product of interaction between nursing philosophy, theory, practice, and research. The complexity of nursing as an artistic expression of nursing knowledge in practice will be revealed in discussions of nursing care situations. So what does that mean? Well, we're going to be looking at what nursing knowledge is. What do nurses think nursing is? What are different philosophical perspectives of nursing? You'll be doing a lot of these deep readings, or these very intense readings. You'll be reading them, and I want you to think about if you agree or disagree with what the authors are saying. And it's okay to disagree, but it's just important to articulate in your own mind why you disagree, or why you agree for that matter. And then, of course, the last part of this course description really highlights the importance of looking at what evidence-based practice is in nursing, and how do we come up with evidence, and looking at the type of knowledge that we have is really an interaction between many things, such as philosophy, research, experience, practice, and theory. The learning objectives for this course are to explore various perspectives that underlie nursing knowledge and philosophy, explore the significance of classical philosophical thinking on nursing knowledge, analyze nursing philosophies from a variety of perspectives, discuss the relevance of nursing knowledge for the discipline of nursing and one's own nursing practice, explore the implications of nursing as an art and as a science, and synthesize ways of thinking about nursing knowledge to formulate an understanding of a personal philosophy of nursing. So in terms of evaluative activities, we've got the discussion forum. So we've got initial posts, or your original posts, as well as your responses to peers. There are 7 weeks that we're going to have discussion forum posts, and they're worth 4% each for a total of 28%. And so participating in this asynchronous discussion forum is an important way for you to learn. What I'm looking for is insightful posts. I would recommend or expect that you're writing your original post without looking at what anybody else has said first, so that you're really thinking about your own thoughts and reflection on the question. The original posts are due Saturday night, and then there are 2 responses to peers, which are going to be due Monday night. The original posts are around 450 to 500 words. I do not penalize if you go over the recommended word count, unless, let's say, you've gone 3 times the amount over, like if you've gone 1,500 words versus 500 words, and if though what you have to say really does not respond to what is being asked of you. So it's really important to stay focused and really look at what the question is or what is being asked of you, and responding to that very, very, I guess, mindfully and not rambling on. In terms of your response to peers, those should be about around 150 words to 200 words in length. And it's important to, excuse me, really build upon or extend or affirm what other people are saying. So you're not just repeating what somebody else says, you're building upon it, you're challenging them, you're providing a different perspective for them, you're providing a different reference for them as well. I also have participation for 3 weeks, so weeks 1, 6, and 12. And these are, in the form of either a poll or a discussion post, but it is a pass-fail. So I'm not going to be looking at really critiquing what you have to say. If you've responded in how I've asked you to, you'll get 100%. And so those were planned strategically. Week 6, you have your first big paper due. Week 12, you have your second big paper due. So I just wanted to take some of the pressure off you. So that's why these are pass-fail activities. The first major assignment is the Personal Philosophy of Nursing paper, which is due week 6 or February 16th. This assignment will allow students to explore and articulate their own philosophy of nursing. It also asks you to articulate the influences of your personal philosophy and the implications these have on your practice. This paper will be about 8 to 12 pages in length, and that does not include your cover, your title page or your cover page, references and appendices. It's important to follow APA writing style, and I want to see a minimum of 15 peer-reviewed scholarly sources. So I was really reflecting on how I would write a philosophy of nursing statement, and I was thinking about what would be most helpful for you. So I've revised the guidelines that I had originally had in the course outline. So it's important to articulate your philosophy of nursing and include, how do you define nursing? What is your own definition of nursing? And then I want you to consider the nursing meta paradigm. So what is your view on nursing? So in there, you might want to include stuff we've learned over these last few weeks on what is nursing knowledge, and are there multiple epistemologies? Like, is that something that you agree with? Looking at nursing as an art, nursing as a science. So, you would look at nursing and then you would look at the environment. For myself, as somebody that had always worked in public health or community health, the environment is a very important part of how I see nursing, because I don't just look at my client, I look at their environment. So I look at the school environment, I look at the family environment. So how do you see, what is your philosophy on the environment and, nursing and the environment? Then it's also important to articulate how you see the person or client. So for myself, again, my perspective is public health, health promotion. I see the client, as a partner. It's not somebody that I'm doing for, it's somebody that I'm doing with. Then, how do you see health? So, do you see health as something holistic? Do you look at health from a biopsychosocial perspective? Do you see health as just an absence of disease, or do you see health holistically? So tell me, in this philosophical paper, how do you see health as well? So what as well are your values and beliefs about nursing? Then I'd like you to reflect and articulate how your personal experiences have influenced your philosophy, and how do these personal experiences impact your values and behaviors? What are other influences on your personal philosophy? So are there certain practice guidelines or guidelines specific to you as, let's say if you're an ICU nurse. For me, working in community health, I was very much integrated with my philosophy is very much integrated with the community health nursing practice guidelines, as well as the literature on health promotion and public health. And those have influenced my personal philosophy. Which established philosophical perspectives have influenced your personal philosophy? What similarities and differences exist between your perspective and the established perspectives? And for this paper, I think it's really important that you write it from a first-person perspective. I know some people were taught in previous degrees that you should not write like saying I believe or I, but this is a personal philosophy, so I would expect that you would be saying I versus the writer. So as you go through the first 6 weeks of the course readings, what I would recommend that you do is think about your philosophy of nursing as you read the readings. Do you agree with what the readings say? Why or why not? Highlight parts of the readings you can use to complete this particular assignment. I'm one of those that uses various colors of highlighter to color code my thoughts and ideas. So if I agree with something, highlight in yellow, disagree, let's say highlight it in pink. I use sticky notes as well to write my thoughts and ideas. The other thing I want to say is you can, feel free to, if there's certain readings that you're just not connecting with, find your own reading that will enhance your ability to write the paper for this course. So if you're completely disagreeing or having a really difficult time reading one of the articles, then it's okay to, substitute that article with something else that helps you understand nursing philosophy better. So I hope that makes sense. Please, I'd like you to feel free to email me and ask me questions. As I've done in the previous classes that you've taken with me, I would like you to, contact me to set up a time to meet so that we can have a discussion on this paper individually. And even if you want to tell me what you're thinking, some general ideas or some initial ideas, then I can provide you with some feedback. So, again, my big thing is I want to set you up for success when you're writing these papers. I want you to go in writing them knowing what the expectations are, instead of you thinking, I don't understand what Wendy's trying to tell me, or what Wendy wants here. Just ask me, and then I can tell you my thoughts, or if you're on the right track, or if you're not on the right track. Something that you'll notice is for week 3 this week, that the question that I've asked you in the discussion form is going to help you with this final paper, or with this particular paper due on February 16th. So I'm asking you to discuss your initial thoughts on your nursing philosophy. Again, just to get you to start thinking about it, and then your peers will have the opportunity to provide you with some feedback. And hopefully that's helpful for you over the next few weeks as you write this first major paper. There are also 2 presentations or 2 opportunities for you to present in this course. Once during week 7 and once during week 11. I've posted in the course outline the different options for the dates for week 7 and 11. And what I will do is create a sign up forum for you to let me know which day you're signing up for during week 7 and which day you're signing up for during week 11. I typically will grant everybody their wish in terms of which day to present, because oftentimes people are working on a certain day, or they're working nights or evenings or days, and for whatever reason, one of the days works better than the other, because for one of the days I provide a morning and for the other day I provide an afternoon. So you have a choice between presenting in the morning or an afternoon. But depending on how many people sign up for each day will dictate the length of the presentation. So typically the presentations should be will end up being around 15 minutes or 20 minutes, depending on the number of you that sign up per day. And oftentimes what ends up happening is there's such good discussion that people usually end up going over. But I try to keep everybody on task so that we don't end up staying later than what we should be staying. So these presentations are largely participation based, but there is an expectation that you do a professional type of presentation, but most people do really well in these assignments. So for the presentation for week 7 is where you have the opportunity to share your nursing philosophy with your peers. So what you presented in your paper during week 6, you will then provide a presentation for your peers, and you'll have the opportunity for your peers to ask you some questions, and perhaps you might gain some clarity from the insights from your peers, or from listening to what other people have to say, or their different perspectives and how they ended up articulating their philosophy. In week 11, the presentation pertains to the opportunity to share the clinical practice or policy, which you will be writing about in your final paper. And this provides you with the opportunity to facilitate a conversation, which might help provide you with some insight for your final paper. For those of you that took the ethics course with me last semester, some of you had identified how helpful your presentation to the class on your ethical dilemma was in terms of helping guide you for your final paper. So hopefully that will happen with this presentation as well. I will have some guidelines and some marking criteria, but again, this is largely participation based, but an expectation that you do a professional type of presentation where you use PowerPoint and some kind of visual for your classmates. So the final major paper for this course is the clinical practice policy paper, due at the end of the semester, and it is worth 25%. This assignment will examine a practice or a policy within healthcare. It's assumed that students will choose a practice within their occupational scope. The assignment will analyze the realities and the divergences in evidence for this practice or policy. The paper will be around 8 to 12 pages in length, and that excludes your cover page or your title page, your references, or any appendices if you choose to include appendices. It will follow APA writing style and contain a minimum of 12 peer-reviewed scholarly sources, plus any additional peer or professional resources. Examples of a clinical practice or policy could include MAID, the medical assistance in dying. So if you're, working on a particular unit or in mental health where that is a policy that you follow, you might want to choose that. You know, Depending on where you work, you may choose a policy related to vaccination or COVID, or let's say communicable disease testing, anything like that. I'm just trying to think of what people wrote about in the last semester while taking this course. The assignment will consist of an explanation of what the practice or policy is, as well as its significance. There will be an analysis of the strength of the evidence for the practice or policy, identification of the limitations of the evidence for this practice or policy, and analysis of the implications or suggestions for practice. The marking guidelines for the paper will be posted on Moodle. I just need to open the box. I might tweak the guidelines slightly, but at this point, the guidelines, indicate having an interesting introduction, which sets the context for what your paper is about. An explanation of the practice or policy and its significance, an analysis of the strengths of the evidence for practice, for this practice or policy, analysis of the limitations, analysis of the implications or suggestions for nursing practice as art and science, and then as well as the 12 sources, a minimum of 12 sources, spelling, grammar, APA, and then an interesting conclusion which summarizes the key points. And I want to just stress that when I say interesting introduction and interesting conclusion, that is what I would like to see, is something that is thought-provoking, that just helps to capture the attention of your reader. This final assignment is based on the fact that there is a universal acknowledgement that the clinical care provided to individuals should be informed on the best available evidence. And sometimes what we see in our practice is that we have practices in our clinical setting that are outdated, and they don't include the most up-to-date scientific information or research available. Knowledge and evidence derived from robust scholarly methods, as well as other ways of knowledge, should drive our practice, decisions, and change to improve the way we deliver care. Translating research evidence to practice is essential to safe, transparent, effective, and efficient healthcare provision and meeting the expectations of patients, families, and society. Despite its importance, translating research into practice is challenging. There are many frontline nurses that do not want to change the way they practice because they live in the past, or they say this is how we've always done it. I don't want to change the way I'm doing it. And there's a lot of barriers. There's a lot of barriers as well, because sometimes time and money are needed to change a practice. So I just want to provide a little lesson from sports in terms of evidence-based practice. If you have time, I'd recommend watching a podcast called Big Man Can't Shoot, hosted by Malcolm Gladwell. It's a 45-minute thought-provoking podcast, and really the lessons apply to public health, nursing, sports, business, or really any other profession. In the podcast, Malcolm Gladwell talks about Wilt Chamberlain, a basketball icon, and the game he got over 100 points. Wilt was known for being a terrible free throw shooter. Over the season, he was working with Rick Barry on shooting free throws underhand versus overhand. During his iconic game, he ends up shooting free throws underhand and makes 28 out of 32 shots, or 87.5% of the shots. He doesn't continue to shoot underhand in his games to follow, and he goes back to being a terrible free throw shooter. In his book, he says, "I felt silly, like a sissy shooting underhand. I know I was wrong. I know some of the best foul shooters in history shoot that way. I just couldn't do it." Rick Barry was known for his underhand free throws. He talks about how shooting underhand is about physics, and it's the better way to shoot because it's more reliable. There's been studies on it. Rick Barry would miss 9 to 10 free throws an entire season, whereas LeBron James misses 150 a season. And as we know, LeBron shoots overhand versus underhand for free throws. Going back to Chamberlain, he had a problem, tested out possible solution. He fixes the problem, or fixed his weakness as a player, but he goes back to his old ways. There was every incentive for him to throw free throws underhand, because you're a liability if you can't get the ball in the net during the free throw, because the other team can get the ball back. Also, if you can't hit your fouls, you can't be used in a tight game. Your coaches will use somebody else. Shooting underhand was also tested with women, but women also didn't want to shoot underhand or shoot these granny shots, quote unquote. Malcolm Gladwell talks about the fact that good ideas should spread because they're good ideas, because their advantages are obvious. But this isn't always the case because some people have a low threshold for change. He talks about how it takes courage to be good and to be a perfectionist. And perfectionism means that it's better to master a task than please people. Or it's better to be right than it is to be liked. So I want you to think for a minute about how this applies to evidence-based or evidence-informed nursing practice, or translating research knowledge into nursing. What are your experiences with this? In terms of my own experiences as a new public health nurse, I've dealt with this. In the first year of my career, I worked at various health units, either casually or in short temporary positions. And so I did that like many of us do when you're first starting your career, so that you can, end up getting a permanent line. And so I had worked at different places. I was then hired into a permanent line, probably at the end of my first year of working as a nurse. And I remember getting orientated to the Well Child Clinic when I told the nurse about a discovery made at one of the other clinics and why they chose to run things a little bit differently than the way this current clinic where I was hired into was running things. And the response I got from the person orienting me to clinic was, "Do not tell me how they do things at other clinics. You work here and we're not going to change." I don't think I made a suggestion for change for at least, another year at that location, because it appeared as though there was a low threshold for change. And at that time, public health, like to work as a public health nurse, to work in schools or child clinics, it was really hard to get these positions. And a lot of the nurses that had been working at these clinics had either been working, like they had been working there for a number of years, and some of them were actually even close to retirement. So, people were not receptive to change. In my position as a sexual and reproductive health specialist, part of my job is to look at evidence to inform practice. I also conducted evaluations and research. Some of the experienced team members didn't like change either, and were happy to keep things the way they were because it was easier for them, and they just really felt uncomfortable with change. In fact, when I talk about a study, or when I would talk about a study or make suggestions for change based on our clinic statistics, sometimes I would actually get an eye roll. So just wondering, for you to think about if you've ever experienced the eye roll or the sigh. Not everyone is like that, but just some people, they just don't want to hear about something new or how to make how to change something based on data. So I just want you to reflect for a second. Why do you think some people are reluctant to change? Or why do you think nurses in particular might be reluctant to change? Or do you agree? Maybe I've just had bad experiences, and maybe people are more receptive to change in other settings. What has your experience been? Just think about that for a second. So why are some people reluctant to change their practice? Well, as discussed, in a previous slide, some people have a low threshold for change. They just don't like it. They don't feel that they can thrive with change. They feel that it holds them back. Time is a big one. Change takes time and some coordinated effort. And sometimes people don't like the amount of time that it takes, and it takes a lot of time being uncomfortable before you can really get into a groove with the particular change. It also takes effort. And, let's face it, a lot of us are burnt out. Because of COVID, there's a lot of burnout, high burnout rates. Looking at my previous clinical site at Sexual and Reproductive Health, a lot of the nurses had been redeployed or partially redeployed to assist with the COVID response, and adding any other change was just not possible. It just was not doable because it was just too much change too quick. Some of the literature discusses that working with other disciplines may prohibit change because of disciplinary perspectives. So nurses may be receptive to change, but the other disciplines may not be receptive to change. And then some literature also discusses that people like to focus more on finding out the results of the project versus how to implement the results into practice, which seems, a little bit of seems counterproductive, because what's the point of conducting a project? And if you're getting these amazing findings, then what was the point of conducting the project and spending the time and the money and the effort if you're not willing to make changes based on what the project findings were? So thanks for listening to this presentation. I hope that it's helpful for you to understand the course, the objectives of the course, as well as the expectations for the evaluative activities. I would really like to encourage you to contact me if you have any questions. Please feel free to text my cell phone or email me. Sometimes texting me is better, especially if you want an urgent response, because I get lots and lots of emails, and sometimes my emails get buried, especially if I happen to have a day where I get 20 or 30 or 40 emails. I may not scroll down far enough and actually even notice that you've emailed me. So if it's urgent, please feel free to text me. Or if you have emailed and I haven't responded within 24 hours, then feel free to text me. I don't get offended. I actually appreciate it.